What are STDs? STD stands for sexually transmitted diseases, is also known as sexually transmitted infections or STIs. STD are infections that often spread through sexual intercourse. STD can also be transmitted in various ways. How STDs spread? Sexually transmitted diseases can be passed from one person to another through sexual activity including vaginal, oral, and anal sex. They can also be passed from one person to another through intimate physical contact. Moreover, having more than one sex partner can also make an individual vulnerable to the said diseases. Wearing needles or syringes for drug use, ear piercing, tattooing, and the like can also spread these infections. Sexually transmitted diseases don't always cause symptoms, so it is possible to be infected and not being aware about it. Are STDs preventable? The answer is yes. To prevent from having this kind of diseases, know how to protect yourself by sticking to one sexual partner. Use condoms correctly when having sex. Have yearly pelvic exam. Most common types of STDs: HSV1, herpes type 1, usually cold sore. HSV1, herpes type 1, usually genital. HSV2, herpes type 2, usually genital. HSV2, herpes type 2, usually cold sore. HPV, human papillomavirus. HIV, human immunodeficiency virus. Hepatitis A, hepatitis B, hepatitis C, chlamydia, thrush, syphilis, gonorrhea. Herpes, HSV1 and HSV2, two types of herpes. HSV1 is usually oral herpes. HSV2 is usually genital herpes. Symptoms: a blister or a multiple blisters around affected areas, inside the mouth, on the lips, around the lips, genitals, or rectum. HSV1 causes sores around mouth, inside the mouth, and on the lips. With HSV2, the infected person may have cold sore or rashes around the genital area. HPV, human papillomavirus. Vaccines are offered to males and females aged 26 and under who don't have. HPV, the vaccines is a series of 3 shots given over a 6-month duration. Often people don't know or don't have any symptoms and the HPV infection goes away on its own. Some types of HPV can lead to cervical cancer or cancer of the anus or penis. HIV, human immunodeficiency virus. HIV is a virus that attacks the immune system. When HIV progresses, it could cause AIDS, acquired immunodeficiency syndrome symptoms. HIV symptoms may appear from few days to several weeks after a person is first infected. The early symptoms usually go away. Infected person may not have symptoms again for many years. After a certain point, symptoms reappear and then remain. HIV symptoms include swollen lymph nodes, extreme tiredness, weight loss, fever, night sweats. Hepatitis B is a serious disease caused by a virus hepatitis B. It can cause lifelong infection, cirrhosis of the liver, liver cancer, liver failure, and death. Hepatitis B symptoms: jaundice. Its symptoms causes yellowing of the skin, whites of the eyes, and or brownish or orange tint to the urine. Unusually light-colored stool, fever, unexplained fatigue that persists for weeks or months, gastrointestinal symptoms such as loss of appetite, nausea and vomiting, abdominal pain. Frequently, there will be no symptoms. It is only discovered in a blood test. Hepatitis C. Hepatitis C don't show any symptoms or signs. If liver damage occurs, the following symptoms may occur: jaundice, condition of yellowing eyes and skin as well as dark urine, stomach pain, loss of appetite, lethargic, nausea. Chlamydia. Chlamydia is easily spread because it often causes no symptoms. About 75% of infections in women and 50% in men. It may unknowingly pass to sexual partners. Symptoms in women: abnormal vaginal discharge that may have an odor, bleeding between periods, painful periods, abdominal pain with fever, pain when having sex, itching or burning in or around the vagina, pain when urinating. In men, small amounts of clear or cloudy discharge, urination, burning, and itching around the opening of the penis, swelling around testicle. Thrush. Thrush is an infection of the mouth caused by Candida fungus, also known as yeast. The open growth of Candida causes thrush. The infection could be spread by kissing or performing oral on an individual with this condition. Symptoms: a common sign of thrush is presence of creamy, white, slightly raised lesion in your mouth, tongue, or inner cheeks, roof of your mouth, gums, tonsils, or back of your throat, pain or difficulty swallowing, a feeling that food gets stuck in your throat or mid-chest area, fever if the infection spread beyond the esophagus, itching feeling around the infected area. Syphilis. Syphilis is a highly contagious disease spread primarily by sexual activity. Symptoms: there is 3 stages of syphilis. Early or primary syphilis. Sore could occur on genitals, in or around the mouth 10 to 90 days after the exposure. Sore are present on where the virus entered the body. Develop one sore or a group of sores. Sores are round, hard, and painless. Secondary stage. It begins within 6 weeks to 6 months after exposure. Sores could be found on the genitals, anus, or mouth. Discolored spots may occur at the origin of the infection. Rash on the soles of the feet or hands. Muscle cramps, headaches, and lack of energy may occur. Hair loss, swollen glands in the neck and aching when swallowing could occur. Moist warts on the groin. White patches inside the mouth, swollen lymph glands, fever and weight loss. Latent syphilis or tertiary syphilis. This could be treated during the early stages. It's usually cured without complications if antibiotics are taken.